We have recently heard a lot of concerns from pregnant women about COVID-19 and its impact on infants. So we brought in Dr. Jim Greenberg to talk to us about why it is still safe to deliver at a hospital. Hello, Dr. Greenberg.
How are you, Lauren?
I'm doing well. Thank you for joining us today.
No problem.
So our first question is, what are the risks to the baby if mom delivers at home versus in a hospital?
We like to think of having a baby as something that's natural and that goes well all the time. But every so often there are problems that are not predictable that come up with the baby during delivery. And some of those problems can actually be quite serious and require immediate attention from healthcare providers. And we found through studies that have been published, some very, very recently, that babies are at a higher risk when they're born at home because the resources just aren't in place to provide that care when it is necessary. So in general, home deliveries don't have the same odds of a good outcome as a delivery in a hospital. So the concern that really is coming up right now has to do with COVID-19 and whether that adds an extra risk to delivering in the hospital setting. So if we think about what's happening in hospitals right now, there's incredible attention being paid to COVID-19. Hospital personnel are trained in how to not only follow the basic rules that we're all asked to follow in our daily lives around social distancing and hand hygiene and so on, but they're trained in how to use personal protective equipment, gowns and masks and so on, and how to use them properly. You may see many people walking around with masks and other things now. Most of those people are not using those items in a proper way that will reduce their risk and reduce the risk for other people. In the hospital setting, the healthcare personnel are very well trained in order to do that. The hospital setting also is, of course, the place where the trained providers can be available in case the baby has a problem and can be available immediately. And that can make the difference between life and death and can also make the difference between a baby with a healthy outcome and a baby who might survive a delivery but have significant complications that can be long-lasting after delivery. So the hospital setting is safer for the baby in that way as well. We think about home delivery, a lot of those issues related to COVID-19 come into play. There are no restrictions, for example, on visitors. But if you think about right now, unfortunately, having lots of people together, even if they all feel well, might not be the safest thing from a COVID-19 standpoint. And therefore, the visitor restrictions, as difficult as they are in the hospital, are there not only to keep the staff safe, but to keep mom and baby safe as well. COVID-19 can be a devastating infection, especially for adults, and that includes moms. So doing everything we can to minimize that during the time of delivery is the best option.